other organ dysfunctions and coma can be other symptoms happening. So vast majority of cases, again, symptoms are mild. This course of illness can last for up to 2 weeks. It's only the minority, which is usually age more than 65, 70, or people who have other illnesses such as diabetes, high blood pressure, heart disease, breathing problems, or being very overweight. They tend to progress to severe illness, that is usually severe pneumonia or organ failure. Once you get severe illness, the course of the disease could run for weeks, rather than instead of 1 to 2 weeks, can last for 3 to 6 weeks. So again, for all the science students, how does the virus enter the body? We usually breathe in the virus. Once we breathe the virus in, there is something called the ACE2 protein within our lungs, and the virus gets attached to this protein. And once it's attached, the virus starts replicating and starts spreading elsewhere. And one of the things with this ACE2 protein is it's just not in the lungs, it's there in our stomach, our digestive system, in our brain, our heart, and almost every part of the body. And for the same reasons, the virus can affect different organs too. So the most common is the lungs, but digestive system, which is why the people can come with diarrhea and vomiting. So how do we diagnose this? There's something called, you must have all heard about the PCR, which is called polymerase chain reaction. And the test is called real-time reverse transcription. So RT-PCR test. So usually a swab is taken from the nose or the throat. And in this machine, the machine can recognize even a small amount of RNA from the virus. And so that's why it's very, very highly sensitive. So if someone had the virus, about 70% chance that this test will pick it up. But there's still a 30% chance that the test could be negative and someone could have the virus. So in such cases, usually we try to repeat the test if we suspect that the patient has the illness and virus. We repeat it after again for 2 to 3 days time. Apart from one of the problems with the RT-PCR, it takes about a day or two for the reports to come through, but there's something called as the antigen test, which is less accurate test, but gives a quicker report. And there's also something called as the antibody test. Antibodies are our body's immune response, or the bullets our body makes to fight the virus. And you can measure these antibodies. And if someone has antibodies, it indicates that they have been exposed to the virus at some point. So presence of antibodies doesn't mean that patient already has the acute illness now. But if there are antibodies, it means that you have had the virus and you have recovered from the virus now. So now how testing has been done? If you look at different countries and the number of tests done, so India stands somewhere in the bottom here. And some of the European countries, Australia, United States, there's a lot of testing which is done. India tests are relatively less, but nevertheless, for less number of tests, we have more patients. So share of COVID tests that are positive. So in Mexico, for almost every test done seem to be positive. At least 50% of the tests are positive. In India, we have about 10% of tests positive. One of the things with COVID-19 is the fear. Is it going to be fatal? So the answer is no. So in the vast majority of the cases, the illness is mild. You get a cold, maybe a slight bit of cough. A couple of days later, you're well and recovered. And mortality, which is number of people who die from the illness, is about 1 to 5%, but seems to be variable between different countries. Uh, but if in the older age group, especially people who are more than 70, the death rate could be as high as 20% to 30%. So worldwide deaths, you can see as the cases have increased, number of deaths have increased. So most deaths again has been in countries where there have been more cases. So India, America, Brazil, Russia seems to be the cases where there are more deaths. But if you look at daily new confirmed deaths, India is actually fairly, number of deaths are not too high. But if you look at the South American countries, the death and America death rates are much higher compared to India. One of the reasons for why this could be is, so in India, the illness came about 3 months after the virus had spread in Europe and America, and we at least partly knew how to treat the virus. And also, it's thought that maybe we have with a higher viral infections in India, we may have a slightly better immunity, though that's slightly controversial. So, the number of deaths have crossed 1 lakh earlier this month. As the cases are dropping down, deaths in India have also dropped down. So, which is again reassuring. And as I was saying, deaths in India is relatively low compared to. So, China, I suppose they didn't know how to treat the virus at all. So, there's much higher deaths and much lower deaths. The lighter the color, the lower the deaths, and it's only about 1 to 2% in India. Compared to China, death rates were much higher. So this is what the case fatality rate. So until April, we really didn't know what to do. But since April, we knew that some of the treatments, especially treatments called as steroids, so we know how to recognize the illness. We know how to treat at least in supportive ways. And so the death rates are gradually falling. Compared to how does COVID-19 compare to other viral illnesses? The earliest SARS-CoV-1 had 10% death rates, 34% for the Middle Eastern respiratory syndrome virus, Ebola virus 50%. So they were more deadly viruses. But with coronavirus, it's about 1 to 2%. It's slightly more fatal than the common cold, or seasonal flu, which carries about 1.1%. But nevertheless, the spread of Ebola virus was not as much. So Ebola virus could be easily curtailed, but coronavirus has spread to a lot more people, so there's more number of deaths. So what are the treatments? So prevention is always better than cure. So there's a lot of work underway for finding a vaccine, but it's probably unlikely that we'll have a vaccine this year. Maybe early next year we might have a vaccine. There's no specific treatment just for COVID-19, but there are some treatments which are used for other viral infections, which has also worked for COVID. The Karnataka government and the Indian government have set guidelines about how we treat viral COVID-19 infections. These guidelines seem to be changing every few months as we know which treatments are effective or not as effective. One of the things is antibiotics. I have to stress that antibiotics are not useful to treat COVID-19 infections. So for people who are admitted to hospitals, we sometimes use antibiotics because they get added bacterial infections along with COVID-19. But when you're at home and if you have had COVID infection, or if you know someone who's had COVID infection and if they're worried that the doctor is not giving them antibiotics don't have a role to play. So treatment depending upon the severity and the stage of the illness. Most COVID-19 infections are now treated at home with some supportive treatments such as vitamin C and zinc tablets. for people who need hospital admission and have breathing problems, we use something called as steroids, which reduces the immune reaction to the virus and helps heal faster. Then we also use blood thinners and some antiviral drugs called remdesivir and so there are some treatments which are available, which are to work, which also work to some extent. So remdesivir is one such injection which seems to have at least reduced. So we use this in moderate to severe illness, and it seems to be helping our patients. So how does it spread? The virus spreads from person to person via respiratory droplets, usually coughing, sneezing, talking, where our saliva and respiratory drops come out of our mouth and our nose, and the person in close contact with us can breathe in these droplets and the virus along with it. And apart from this, the virus is also considered that once you cough and sneeze on a surface, the virus can stay on the surface. You touch the surface and touch your mouth or your nose or your eyes, and the virus can spread in. And that's where the prevention comes in. So wear a mask and wash your hands and sanitize your hands regularly. And this is one of the ways that we could prevent the virus. Apart from this, there's a lot of home remedies which everyone recommends. The World Health Organization has come up with some advice saying, chilies, garlic, turmeric may have benefit, but they're not proven treatments. You could try them, but they're not an alternative to using a face mask or washing your hands regularly or sanitizing it. And for all the Trump fans, if any of you are fans of Trump, I think Trump had come with things like, you can drink bleach to cure COVID, and certainly I don't think that was something anyone should do. So again, sanitize your hands, wash thoroughly, and use soap or water or alcohol-based hand sanitizer. Social distancing, it's 6 feet from apart from people. Avoid touching your face with unwashed hands, and wear a mask which covers the nose and the mouth. So whenever you are in next to a person within 6 feet distance, and if anyone has symptoms, please stay at home. And one of the things with the coronavirus is you can get two viruses infections at the same time. So one is coronavirus and the other is the regular influenza or flu virus. So people who are at high risk, elderly, should consider having the flu vaccination annually. So instead of greeting hands with a shake hand, we could go with the namaste of the Indian or the Japanese bowing style. So do's and don'ts. So this is the World Health Organization. Avoid crowded places. Avoid close contact settings. Avoid confined and enclosed spaces with poor ventilation. So these are, and that's why many times schools and colleges have been shut down, and why we are all sitting in a webinar today rather than a face-to-face talk. And again, masks. So use clean masks. Wear your mask properly, which covers your nose and mouth. So improper use of face masks is a commonly seen thing. So this is the ear guard mask, the peekaboo mask, the chin strap mask, the headband mask, and the unwashed mask. So we come across all this, and I'm sure some of us have done this already. So I would strongly encourage that you use a clean mask and cover your face, the nose and the mouth with a mask. So that is the only way. The only way to prevent and flatten the curve is to prevent the virus from spreading. So same thing, once you've had the virus, if you're sick, stay home, cover your cough or sneeze with a tissue or a handkerchief, and either wash the handkerchief regularly or throw the tissue in the trash. Disinfect, regularly clean, frequently touch objects and surfaces. You can call our national helpline 1075 or the Karnataka local helpline numbers 14410 Optometra helpline if you have any symptoms, or you could see or teleconsult your doctor these days. So one of the most commonly asked questions is, what are the prospects of a vaccine? So this is from an article from the Nature journal. There are about 120 different vaccines currently in development. Though we don't have a vaccine which we know works, so we'll have to wait for a few more months. So this is the virus, how the virus affects people, how we can stop its spread, what precautions we take. But the effects of the pandemic have been, we've seen other effects of the pandemic as well. So one is mental health problems, economic crisis, conflicts, being the not so good side of pandemics. And the good sides, I suppose there have been environmental benefits with less carbon dioxide emissions, with less air travel, people are working from home, less traffic on roads in Bangalore, possibly someone having better work-life balance. People have now having a chance to look at their healthcare, and more investment is done in healthcare. So we might have better hospitals and better facilities, and increased use of information and communication technology. So mental health problems are, yes, this is the unseen pandemic. So there's, since the lockdown came in, people are restricted to their homes. Their usual routine is gone. There's a fear of virus, people getting infected with virus. We are not socializing. Humans are social animals, and certainly we are not meeting people. You don't even get to wave at your neighbor these days. And the stresses, especially for students, the stress or uncertainties about exams, the future, all these is causing a lot more stress. And with stress comes anxiety and mental health problems. So we say, be kind to your mind. As being kind to your body, we'll also have to be kind to your mind. So if you are feeling stressed, anxious, always pause, breathe, and reflect. Especially if you see most of our TV channels have always COVID-19, and whatever we see is negative deaths and sufferings of people. So whenever feeling stress, I think we should pause, take slow, deep breaths, which always helps improve circulation, calms down your brain, and also reflect on why we are getting stressed. One of the things is to deal with stress is connect with others. So maybe it might be a friend, it might be a family member, or it might be a pet at home. So once we start connecting with others, we always relax, and this connection can be just not direct physically, but you can call a person on the phone, or you can now talk on Zoom. So there are several other ways to connect with each other. There's always once a pandemic set in, our health routine has changed. So, usually previously, if I were to take my own routine, I used to wake up at 6 o'clock in the morning, get my kids ready to school, then get to work. And now, with the no school for kids, I'm waking up late. My workers at hospital is reduced. Uh, my whole routine has changed. So I probably eat at different times, and uh, the routine is gone. And my routine is usually fixed around many people. My mom who cooks for me depends upon me to eat on time, and there's several other things going on. So if you keep to a healthy routine, it'll make sure that you are busy, and at the same time your health is maintained. And be kind to yourself and others. I know it's with stress and anxiety, people can sometimes be rude, angry, mood changes, but being kind to others and also being kind to yourself helps. And always, if someone is stressed, not happy, reach out for help. And there's nothing wrong in seeing a psychiatrist if necessary, or telling your difficulties to other people. So the other parts of the pandemic, it is impacted the global economic growth. This is the projection in 2020. So 2% growth every year, and minus 2% projected this year. So apart from this, there have been more conflicts. So there was Chinese invasion, the Yemen, Afghanistan, Syria conflicts. We thought, with the virus spreading, there might be less conflicts, but there's still ongoing conflicts. Though in some countries, Colombia and Philippines, the rebels have laid down arms as because of the severe spread of coronavirus. And there's also been a truce between the presidency claimants in Venezuela. So there are some positive aspects of the pandemic, though there are some increased conflicts too. And one of the other concepts of this pandemic is the mother of trying to heal ourselves. The annual change in global emissions, you can see, has dropped down. Number of commercial flights have dropped down, and there have been news of increased wildlife sightings in Canada and India. You might have seen WhatsApp forward messages of these two. So work-life balance, again, some of them have found no more Monday blues, stronger family connections because you are at home and you are as a family. Some find more time to exercise and a healthier lifestyle. So possibly many have had an improved work-life balance. Some of my friends who are traveling 2 hours to work, and because they're working from home, they have an extra 4 hours per day. So I already talked about greater investment in healthcare and in better use of information and communication technology. So with that, my take-home points was, so COVID-19 is an infectious disease of the human respiratory system, and it's caused by SARS-CoV-2 virus. Disease is almost always mild and causes fever, dry cough, shortness of breath, and fatigue. Older people and at-risk populations, such as people with diabetes, may develop life-threatening symptoms. Certain treatments reduce severity of illness. We don't have a vaccine yet. And the mainstay is to protect yourself from the virus through sanitizing, social distancing, and avoiding crowds. And always be positive and look at the brighter side of the pandemic. So keep calm and stay safe. And I finish my talk there and would be happy to answer any questions.
Dear students, if you have any queries, you want to ask any doubts, Dr. Sudeep is there. so that he can clarify anything you would like to know.
Dr. Sudeep, my first and the last question,
Yes.
probably. Yeah, one of
Yes,
my
ma'am.
colleague, asymptomatic, what you call it as a asymptomatic.
Yes,
He didn't
yes,
have any
yes.
symptoms.
Asymptomatic. Yes.
Okay.
Sure.
He has been detected with positive, corona positive.
Yes.
Okay.
Yeah.
Believe it or
Yes, ma'am.
not, he took a treatment for 45 days, more than 45 days. He is in the middle aged, probably 40,
Yeah.
45 years.
Yeah.
That's it.
Yeah.
Okay.
Yeah.
Even now, whenever he goes for testing, he gets positive only.
Yes, ma'am.
And he could not able to come out of that corona positive only. It is not
Sure.
becoming negative only.
Sure, ma'am.
What is the reason for that?
Yes, ma'am.
Yeah.
Um, some part which I'm not excluded is people who had the virus continue to shed the virus for some time. And people who have recovered from the illness can sometimes have virus, but these are dead viruses. The RT-PCR test is a very, very sensitive test. It can pick up the RNA part of the virus, but whether it's the dead or the live virus, the test can't differentiate. So previously, when the coronavirus first started, and when Victoria Hospital was the center, and when doctors started treating uh, patients with the virus, as soon as you get admitted, you got a test, and at the time of discharge, only if your virus test was negative, then we used to discharge. But what we have learned from this is people can have no symptoms. They stop spreading the virus, but the test can be positive because they're shedding dead viral particles. So this is especially in people who have moderate to severe illness. And there have been reports, as the example you gave, of patients being positive for up to 3 months after recovery from the illness, but we don't consider them as spreaders of the virus.
Okay, but still he is suffering, no? He is suffering.
So one symptoms of the virus, usually once you get a viral infection and have lung disease, some people have lung damage because of the virus. So there is scarring of the lungs that can stay on with them for a long time. The cough, the viral symptoms of fatigue and body aches might persist for weeks and weeks. Though they don't have active illness, the symptoms, the recovery phase can sometimes take a long time.
Sir, there is a question from one more madam, Ramya. Is it required for everyone to get tested in case of no symptoms also?
No symptoms. Yeah. So this is, if you don't have symptoms, definitely no test is needed. Second, if you have come in contact with someone who has had the virus recently, which is commonly the scenario where I get asked this question. I've been exposed to the virus. I've had a family member or a friend who's had the virus. Should I get myself tested? We currently are recommending testing to anyone who has had symptoms. If you don't have symptoms, you don't need the test done. But if you've been a primary contact of a person with the virus, you should quarantine yourself so that you don't spread the virus to others. But testing is not necessary.
Okay. Ma'am, any more questions? Students, do you have any more questions to be asked? Ma'am, is there any questions on the chat box?
No.
No. Okay. Then I think
Vaccination will come very shortly, Ramya ma'am. Wait. He has also given us 1 year time.
if Dr. Sudeep could throw light on the process of vaccination. Is
Vaccination, yeah.
Now, vaccination again, I have been listening to various talks from experts, but we still don't have a timeline. But I have, from a hospital, working in a hospital, recently BBMP is taking details of all healthcare workers